Several key health facilities in Gauteng, including Maxeke and Helen Joseph, have been operating under severe strain due to ongoing water infrastructure maintenance set to run until July 21st. Now, from surgeries to sanitation, the disruptions have placed immense pressure on the province's ability to deliver consistent healthcare services. While many facilities have activated backup systems like JoJo tanks and boreholes, there are growing concerns about long-term resilience. Joining us now is Motalatale Modiba, spokesperson for the Gauteng Department of Health. Motalatale, always good to speak to you. Appreciate your time. Now, before we go into this conversation, we've just been talking to Refuwe Sibuku moments ago, and you were privy to that conversation around those 25 initiates who suffered the most traumatic experiences. Just walk us through your thoughts on that.
Thank you, Hugo. Look, it's very traumatic listening to the harrowing stories that parents are telling around this. And we know that annually, around this period of circumcisions, we go through this type of stories. And it's something that, from our side, as the Gauteng Department of Health, we have taken an initiative to educate the public and to warn them as well, because we also became aware recently of some people that were going around communities recruiting young boys to circumcision, claiming to be representing a particular doctor. And we had to act proactively and warn the public not to allow their children to be taken to sites that have not been verified and that we can't confirm. In fact, we published a list of sites that or service providers that work with the department that we've accredited, which means we've vetted them, we've gone to site, we know that they comply in terms of health standards and in terms of the practices that they do on site, that those practices will not place our children in harm. We've actually shared those sites on our various platforms, including on our website, so that the public can actually go there. We've also provided contact details of the officials in the 5 districts, for such that if anyone is unsure, they're able to make a call and find out as to whether the sites where they are taking their children are actually registered sites, and they're not going to lead to a situation like the one that we're talking about now, where you could even tell from what the parents are saying that the people that are doing these circumcisions are not even following proper processes, so we were really pleading with the public to be more cautious and to rather err on the side of caution by verifying and double checking with authorities first.
My final question on this before we move obviously to the reason we'd asked you to come on to the show speaks to the issue around penalties for those that have been found guilty of running these schools. I mean, the continued abuse of parents' trust, if you will, over the years seems to suggest that there isn't a penalty that's strong enough.
Yeah, that's something that I think government as a whole needs to obviously look at. In particular, our sister department, the Cooperative Governance and Traditional Affairs, as you would know, that this area falls under their scope in terms of their mandate. We work with them from a clinical point of view in terms of ensuring that we accredit these sites, ensuring that healthcare standards are followed at the standards, but also to provide that backup in case that we need to respond from a health point of view. But in terms of enforcing and ensuring that the relevant penalties are done, it's a matter that I think our sister departments, both COPTA and the law enforcement agencies, would need to probably act more strongly on. But I think the best form of prevention here would be for parents and for communities to be aware and to be alert, so that they are able to distinguish between a bogus site and sites that are established, because sites that are established are monitored and they subject themselves to actually being monitored.
Right, fantastic. All right, now for the issue at hand, would you give us a snapshot of how widespread the water disruptions are across Gauteng's healthcare facilities at the moment?
The issue at hand was affecting mainly 5 facilities in the Johannesburg area, because you recall that there are 3 substations that Rainwater communicated on to say they will be doing extensive infrastructure maintenance work on those lines. I think that is your Aikenhof, your short copies, and another site as well where they are doing that. I think it's Palmit where they are doing this work. So we've got a couple of facilities that are along that line in terms of they get their feed from the affected lines. So what has happened with us is that initially Charlotte Maxeke was impacted, Helen Joseph were impacted, South Rand, including what you call Hillbrow CHC and Alice CHC. But the good news now is that Charlotte Maxeke, since yesterday, they've got full water supply. The supply there has been restored. South Rand water supply has been restored. Helen Joseph, their water supply has been restored, including Alex Community Health Center. The only area where we're still having a challenge is the Hillbrow Community Health Center, because the entire Hillbrow area is still impacted. So there we are relying on Joburg Water, which has been supplying us with water tankers to replenish water in the Jojo tanks that we've got on site, and we're using then that to feed the community health center, which operates for 24 hours. The rest of the other facilities are back to normal supply. But I must also hasten to say that even before the water was restored in those areas, Charlotte Maxeke was never really impacted. Remember, they've got 9,000 storage, 9 million liters storage capacity on site, which means they are able to go for at least 4 days without any help from anyone. So the situation did not get there. Helen Joseph had to prioritize emergencies over elective surgeries, but now they are back to normal as well. So it's only now at the moment only Hillbrow CHC that is still impacted. But you must also recall that a community health center, in terms of the level of care, they render certain limited services from a primary healthcare point of view. Even under normal circumstances, for complicated cases, they will still have to refer those to other facilities like your Charlotte Maxeke, your Christiane Para, because those would be facilities that offer a higher level of care. So services are continuing at CHC, although we are operating through emergency supply that is provided through tankers from Joburg Water and also through the Jojo tanks that are on site.
Motalatale, you talk about Charlotte Maxeke and the fact that it's able to go 4 days without services being impacted if they do run short of Joburg water, if you will, or Rand water in this instance. Is there a plan to get other hospitals and facilities within the Joburg area to the same level of resilience?
All our facilities, majority of them, they've got reservoirs to start with, because remember that even with normal water supply, water comes through the facility, it goes through the reservoir, then it goes to the facility. So we've got the reservoirs, but they are of different capacities depending on the length where the facility is situated. You've got constraints there. We've got also tankers as well, where we need to supplement with tankers. Some of the facilities have got boreholes, like your Helen Joseph. While it was impacted, it's got about 3 tankers that they are able to give it about just under 300,000 liters of water at a time. And they've got a borehole, and that borehole has got a yield of about 8,000 liters per hour, intermittently so. So we've got a mixture of interventions in a facility that allows us to continue operating. If you look at Rahima Musa, for example, they've got a borehole because they are on a line that is very sensitive, that is constantly being affected. So over and above the normal supply line, they have a borehole on site that has got a better yield. They also have tankers as well that they are able to make use of. So the issue of increasing storage capacity is something that we continuously do. You'll recall that last year we built a reservoir at Pulusong Hospital where we increased the capacity. The additional reservoir had a capacity of 500,000 liters of water. So we've been, where there's an opportunity for us to increase because maybe we've got enough space, we're able to do that. But where we don't, we explore other means. And even with boreholes, not all table beds in terms of land are able to give you a yield in terms of what. Some areas you can't get anything, so we can't drill there. And others, you will be advised that geologically speaking, it's not advisable to drill there. So it's a combination of solutions that are applicable to the unique circumstances of a facility. But the principle is that There is reservoirs on site that allow us to have at least some capacity to be able to operate between 2 to 4 days in case where services are interrupted for one reason or another. We've got tankers as well, but we've also entered into arrangements with water utilities and the municipalities where we operate so that they're able to provide backup through continuous supply of water tankers. We've also, as a department ourselves, put in place an arrangement where we've got contractors on call in case the municipalities are also overwhelmed. We're able to then tap into that and see how much we're able to be supplied with additional water in our facilities.
Right, as we wrap up the conversation, what advice or updates are being communicated to patients and their families who rely on these facilities?
We utilize yourselves as the media too, because obviously in a time like this, the quickest form of communication becomes radio and TV. To communicate with the public and families, but with patients on site, we communicate with them directly through our healthcare workers who are able to relay messages. But usually, Hugo, patients will only feel it when we start to say we have to maybe prioritize emergencies over electives, but usually, like in Charlotte, they might not even know that we've got a problem of water outside, except for when they hear it on radio, because inside things are continuing as normal.